over in LA. And so I'm just letting the weather do what it does because I know the sun's gonna eventually come out and shine. So I'm grateful. How about yourself?
I'm good. I'm good. I'm sure we'll have some rain later in the night or maybe even in the afternoon. Who knows? We need it here in Mexico City. So it's starting to happen now.
So I'm glad that you addressed that you are in Mexico City. You know, many people who join us are mainly kind of like in the Bay Area and different parts of the United States. But I felt that your topic was something that I wanted to bring to the people, you know, because mindfulness is on so many different levels. And so I wanted to talk about regenerative health and medicine because oftentimes we only know what we're taught in Western medicine. We don't see all the other things that are in different countries or different practices culturally. And so I definitely felt that this is a necessary topic because, again, the states don't practice certain things here. And so I definitely would like you to share just a bit about yourself and how you even got to what was your journey, you know, in considering spirit, mindfulness, and where you are now, what you offer, you know, and then I'll go into a little bit of how you helped my father and how what you offer has helped many other people.
Okay. Well, I'm known as Dr. Baz Moreno. My name is Baz Moreno. I have a PhD in natural medicine. I earned my degree back in 2000, so I've had my degree for a while. I ended up relocating to Mexico City in 2012, the beginning of 2012, due to marriage. I had married a woman here from Mexico City, and she thought that Mexico would be better for me due to the fact that I was involved with holistic or alternative medicine. Of course, I got here. I started teaching about 2 months after arriving. And then I was introduced to platelet-rich plasma, where you take blood from the person and you utilize it to regenerate certain things, be it the joints in the body, organs, or something of that nature. So I started in Atlanta with my career. But what I knew in America, what I had learned in the university there was nothing compared to what I've learned here in Mexico City or in Mexico over the last 12 years. With that, I should say that I've had the opportunity to take different capacitation classes, whereas because I'm not a citizen, I am a permanent resident, I'm allowed to take classes with other doctors. And because of that, I now have my cédula, or what they call or consider to be a professional license. So I did earn that in 2022. So it took me about 10 years to earn it. You know, that's basically who I am. I'm very much involved with regenerative medicine. I think it is very necessary. I think it is something that is just fascinating. The good thing about regenerative medicine is that when we think about African spirituality and you hear about people burying the placenta at the birth in hopes of using it later when someone becomes sick, that's basically where we're at now. My journey into regenerative medicine is interesting because, as I said, I was introduced via platelet-rich plasma, and then I went to apitherapy, or therapy that utilizes the different properties from the beehive. In particularly, I should speak of the bee venom. So from there, I ended up getting involved with stem cells. And of course, I always had patients that would guide me and assist me and teach me and help me. So I'm always partial to patients because I think they're better than textbooks for the simple reason that they can actually tell me things, teach me things that the books cannot. And therefore, I don't have to be robotic. I don't have to worry about not being able to be flexible or expand or accept what other people have to say. That's part of my growth. That's how I got to where I'm at now. And without that, I'd be starving here in Mexico.
Well, we're glad that you aren't starving, and we're glad that you are helping people in the journey. You know, I think when I'm listening to you, I think of placenta being life and birth and all of these things. And as a postpartum doula and a doula, I understand, you know, the importance of the mothers, you know, encapsulating, and I'm aware of the lotus birth and allowing the placenta to still be attached to the baby for the baby to still get the nutrients, as well as if the mother then, uses the placenta to take the placenta pills and as they're breastfeeding, they're still getting the nutrients themselves. And then you mentioned bees. We know that bees, without them being on this planet, there would be no life. So just to kind of not overwhelm people, because I do understand that it is a lot of information, and your website has been placed in the chat for those that want to further, kind of look into it, because it's so much information. It is cellrenew.info for those that are catching the recording that is not there, that are not in the chat. So could you speak a little bit about the bee venom or bees, period? Because I know bee pollen is a good thing for us to, put into our diet, but can you tell us the importance of the bee and how that works in holistic and, alternative medicine? And then we can kind of touch on the placenta.
For me, the bee would be the gateway to regenerative medicine. I say that simply because when we look at what we can do with the apitoxin or with the bee venom, and there is a difference. With a direct bee sting, we're able to help people with all types of ailments. But with the bee venom, once it has been clinically prepared the way that I have it, so that it can be injected, it's important that it be injected. By stinging it, there's a possibility that a person may react allergically to it. Whereas when it's in the clinical state or form, the likelihood of the person having a reaction has been minimized. So when I look at the fact that the bee gives us, as you said, the pollen, it gives us propolis, it gives us the royal jelly. So we have different things. I use all of these in injectable form. I do not use them orally. I think that the injection is superior to oral products simply because they do not have to mix with the stomach acids, and due to the fact that they're entering into the bloodstream and intermingling with the cells. So it makes it better when we can inject these things. So when it comes to bee venom, I also use it because it increases proliferation or multiplication of the stem cells once they have been introduced into the body. In terms of cancer, the apitoxin is able to kill that cancer. So those are some of the reasons that I use the bee or the bee venom. I know people talk a lot about Irish moss, sea moss. I prefer to use bee pollen and also the propolis. I just find them to be much stronger. But I also use shilajit, which is a mineral that is stone. So I know that sea moss is very high, but I don't think it compares to the minerals and the herbs that I just mentioned.
It's interesting because we talked about Shilajit last week with our guest who talked about Ayurvedic medicine. So I love how you've come back to support the benefits, that there's really more of a benefit in Shilajit compared to what the hype is about sea moss. Not knocking anyone that takes sea moss. If that's for you, that's for you. Again, we're just people that are, as he shared, based off of his experience and even the guests before and their experience, how much even just Shilajit can be part of your healing, and now added with the bee pollen, because bee pollen, I just saw somebody make a champagne mimosa with bee pollen. Interesting.
Oh, wow.
Right, very interesting. And so when you think of that in African spirituality and this bee and the energy with the bee, what do you see how that's connected to one's spirit and what they may be dealing with in regards to their health, and how that all may play a role when you connect the dots?
I wouldn't be able to connect those dots. I'm just not there, but I will say this. In terms of how I go about healing, the 4 quadrants that I had to address would be the mental, the emotional, the spiritual, and the physical. So I had to look at all of those aspects. I know some people would like to be able to just take what it is that I have to offer and think that it's going to make corrections, but it won't, because they're not looking at the fact that they got to where they're at based on spirituality, based on their emotions, based on their mental. And their physical is only letting them know what it is that has happened with their bodies or even with their mindset. So the thing is to think of taking an injection of apoptosis or stem cells or growth factors and that is going to change something without them changing how they think, it may not work. In addition to that, it is funny that you should mention the mimosa, because when it comes to stem cells, when it comes to the properties of the bee, they will not work if alcohol interferes.
Thank you for saying that, because I that was my thought when I saw it. I was like, I don't know how effective that is, but okay, that works for you. If that works for you, cool. I love how you said you think of all four of those components. I was taken back just now to when my father and I came down to Mexico, and he started the journey and where I was in my journey. And you shared something with me about how strong and intense I was in my communication with him. And when I think of the bee, I think of the sweetness, right? And so even with him, a lot of the sweetness in his life, he was a bit bitter. He was a bit where he was holding on to a lot of grief, which led to his lung cancer, which then traveled into his bones. So thinking of the bones and thinking of the root of things without the skeleton or the root, and not addressing the root. Yes, you have this tool, but he didn't really do the other work, which was still eating the sugars and eating the different things that continue to progress the cancer versus kill the cancer.
Right.
So I really love that you stated that, because it was his mental and emotional did not align with the physical work that was being done. And so that, and spiritual, he was getting there spiritually. That's why he transitioned in peace and let go truly of everything. So I'm always grateful for you in that journey.
Right. I appreciate that. It was very hard for me, but at the same time, I will say that your father, I remember the last conversation that he and I had, because I remember a group of doctors were trying to recruit me, and they wanted me to pay $10,000 as they were recruiting me in order for me to assist them in actually analyzing cases and determining the diagnosis for the person. And I remember your father telling me what he thought about me and my abilities, and that I should not join the group. Not that I wanted to come up with $10,000, but it was like having him tell me where I was at and what I need to do. It really motivated me. It gave me something to look forward to and to do. And I can honestly say that because of persons like him and a few other patients that I'm where I'm at now. Because I took those new beginnings very harshly. It was hard for me because before I saw death as an end, but by dealing with him and a few others, it allowed me to understand why it was happening, why I had been selected, and I grew from it. And that's why, even as you talk about, you mentioned the word roots. It's funny because when we start talking about stem cells and growth factors and the placenta, we're talking about tree of life, and we're talking about roots again. So that's fascinating to me. When I think about it.
Now, what do you find to be the main thing that you work with? Because stem cells and this bee medicine can help many, like looking at your website, which I will share, it shows all of the different benefits of what it assists with. Is there a commonality that you find the majority of your clients are dealing with as a collective?
Most people that I deal with, cancer, diabetes, lupus, Alzheimer's, and other than that, it's going to be something like joint pain. People I have bone on my knees, they'll tell me that. And those are the things that I deal with. So because of that, I can use the apoptosis, I can use the platelet-rich plasma, where I take their blood and separate the red blood cells from the plasma and the platelets. And I also use the stem cells, but I also use growth factors. And the reason I'm saying that is because the reason that I'm having the success that I'm having is because I utilize peptones and exosomes and the apoptosis. Whereas you hear a lot of people talk about stem cells in the United States, and immediately we think that they're very expensive. And yes, they are costly, but not as costly as they are in the United States. For example, 1 milliliter or 1 cc of stem cells in the United States could run anywhere from $5,000 to $20,000. An IV, in which I can only use about 2 milliliters, would cost about $20,000. Whereas in Mexico, you may be looking at a IV running anywhere from $100 to $200, but an injection could run anywhere from probably $50 to $200.
So
So there's
people
a
it's cheaper to just buy a flight and have an experience international and and get the work. It's interesting the medical field in America. I will say that it is a big thing, to generate money. So I love to hear that you have integrity to not take the $10,000 and follow spirit and listen to spirit, because oftentimes, people are being injected with or pumped a lot of different prescriptions that don't really solve the problem. It
right.
just either just alleviates the pain or alleviates, but even still, looking at my dad do chemotherapy in comparison to the work that you did with him, the chemotherapy really destroyed more cells than it did rebuild them. So I speak to that.
That's something that's very difficult because a lot of people will contact me and they're going through chemotherapy. And they ask me, can they continue with the chemotherapy? I know they're accustomed to a lot of holistic practitioners, alternative medical practitioners, naturopaths saying you can continue. I think that that's a cop out because I think they're afraid to actually say what it is that needs to be said. And that is either this or that, because there's no way that they should continue with chemotherapy because it's destroying all cells, be they so-called good or so-called bad. So it's not a good thing. So having that person destroy the cells that could have really assisted me in helping them is a bad thing. For example, a person can have a tumor. We're taught to see the tumor as bad, but we shouldn't see the tumor as a bad thing simply because that tumor is actually so intelligent because those cells have encapsulated the cancer to prevent it from spreading. But then once a biopsy is done, that biopsy now opens it back up and it moves quickly.
Mm-hmm.
So I don't agree with the biopsy, and I don't agree with people undergoing chemotherapy during stem cell therapy.
Yeah, I definitely like to agree with that in regards to the tumor. I dealt with fibroid tumors years ago. I had surgery actually, but before having surgery, I actually was talking to them and actually felt them respond. So when you said intelligence, they started to shrink based off of, and it just wasn't me talking. Let me be clear. It took more than that. It took spiritual work. It took me emotionally dealing with things. It took me a change of diet. It took working out as well and being physical to really do that. However, as I've grown, I'm learning of all of these different things. And so I want to kind of touch upon, because I do want to allow anyone that has questions, if you don't want to turn on your mic, you can put the questions in the chat room. If you want to ask any questions or, give your experience, if you have had experience working with Dr. Baz Moreno, because I do see some new names here. So I know that you have shared with your community, and I'm grateful for them joining us. But could you speak to the placenta? Is there a certain age? Is it voluntarily? Because we know here in America with the placenta, some hospitals fight the mothers from taking their placenta, and we know that the placenta they're getting paid like 50,000 per placenta. But then again, we have those that have birthing plans that they want to take their placenta home, but then the nurses are giving them a lot of like kickback that they cannot, And so what is that process for those that may be like, oh, they're just taking whatever they may be thinking, so that they understood that this is voluntarily. It's not like it's something that is not voluntarily.
Okay, first of all, I'll say I do not know if the women in Mexico are paid for their placenta. I do not know. What I do know is, and I'll probably contradict what I'm about to tell you. Initially, when I went to schools in 2019, the end of 2019, for stem cell therapy to get my diploma for that. But at that time, we were taught that women between the ages of 18 and 21, disease-free, first-time pregnancy, were candidates for placenta. But that has changed because they changed the age to 23. And then COVID came along. With that, because women were taking the vaccine, it brought about other issues. And now doctors in Mexico are starting to have the debate about whether or not stem cell therapy is viable or as effective as it was before. Now, what I will say is this. No longer is the age 18 to 21 or 23. It is now 18 to 40. It does not matter if it's her first time pregnancy or not. In addition to that, it does not even matter if she has a disease because they use sterilization using gamma rays.
Okay.
So because of that, and if she is so affected, so will be the baby. And if that's the case, intelligence should say that we will not be able to use these particular cells.
Yeah.
Okay. Yeah. So when it comes to the placenta can be injected, it can be implanted. Here in Mexico, we use implantation. We do not use transplantation. There is a difference. With transplantation, normally they're taking stem cells from the fatty tissue or from the bone marrow, but they can also take it from the blood. This is how they come about with transplants or transplantation, and it is very expensive. In addition to that, I do not agree with it simply because if the organism is already damaged, why are you expecting the organism, because you take something from it, to be able to heal that particular organism? So I disagree with that. So I disagree with the autologous approach to implants or transplants. What I prefer is the allogeneic approach, where we take from another woman, because we're all interconnected. So now by taking that, you're familiar with me doing the incision and the sutures. I no longer have to do that, much more sophisticated. AI came so much more intelligence in the medical industry even. So now I'm able to take a large gauge needle. The implant has been lyophilized or freeze dried and even pulverized. So now all I have to do is reconstitute it. Once I reconstitute it with the normal saline, I can now inject on both sides using the acupoint. Can be acupoint stomach 25, 26, 30. It does not matter. It just depends on the confidence of the practitioner.